The question we will be discussing in this video is which neurophysiotherapy approach is effective or which one we should choose. The answer is none. Why none of the approaches are found to be effective? Because as I mentioned in the last video, is that these approaches are not based on facts mostly. They are primarily based upon opinions and clinical intuitions of these proponents who developed these approaches, whether it's Bobart, Brainstorm, or Margaret Root, and so on. Because it is based upon their opinions of how nervous system control or their own interpretation of the facts, the fact which they have had at that time, that is nervous system, the reflexes plays a major role in controlling movement. It is partly right, reflexes are an important component of movement control, but they have interpreted wrongly, at least that's what we know now. They thought that there is a hierarchy, there is a higher center, middle center, and lower center, and recovery always happens through certain stages. These are all many assumptions, I would say, their opinions that they have made about how nervous system recover, which are all later proved to be not true. So since their opinions were proven to be not true, the treatment approaches are also found to be not effective. I'll give you one example why they are mostly the approaches should be considered as opinions of those proponents. If you take NDT or Bobart's approach, that most of the treatment is based upon inhibiting abnormal tone, postural tone, or abnormal patterns. That is spasticity they consider as an important factor, that primary impairment that contributes to movement control. But if you take Brunstrom, whereas they actually encourage spasticity in initial few stages. In first, second, and third stage, they actually maybe not third stage, but in at some part of the treatment, they encourage spasticity. Now, if you think, how come one approach think that spasticity is something that should be reduced, that should be inhibited because it is contributing to the movement problem, and another approach thinks that it can be encouraged? That's what I meant by, because this is based upon an opinion. Both cannot be right, isn't it? So their views on why patients have certain problem, contributors of the problem, and their understanding of recovery are all based upon their personal experiences, which is not tested with data. When data was collected and tested, we found that it's not working. Now, should we be disappointed that Bobart approach is no longer a valid approach, no longer a useful approach, NDT? No, we shouldn't. Maybe people who are propagating NDT and Bobart should be disappointed. As clinician, we should, because we have better options. We have now functional activity based therapy, which has shown a lot of promise in improving function of patient with stroke, especially in lower limb function. We have a lot of evidence now, not now, in the past 20-30 years emerging, shows that it is the best available treatment so far. For upper limb functions, we still have a long way to go in improving the function, but still the functional based or task oriented approach is the best available. So I want to conclude by saying that if you are a clinician, our choice is always which is the best available treatment. Can you understand? So we have like one, two, three, four options. We cannot choose this option based upon our personal interest and our personal experience, if you want to say, right? It's not like a dress that you wear, you choose what you like. The treatment has to be based upon truth, or something that is close to the truth, not based upon personal choices of an individual therapist. And this is not just my opinion, and none of what I'm saying is my opinion. These are all the facts. And many countries such as Netherlands and Australia and even in Canada and some parts of US have all moved forward into leaving this approach-based therapy. So today in neurophysiotherapy, approaches has no more role. We have the newer paradigm, at least for many of us in India or in other countries, even many developed countries too. The new paradigm has to be about implementing evidence into using research evidence, which is which has control for bias and other confounders. The into practice, that's evidence informed practice, is the default for us. So we can no longer, think of which approach to be used. And I practice Bobath, I practice PNF, there is new PNF, new Bobath, not getting into all of it. We have a better treatment which is based upon current evidence. Many countries have moved forward. In Netherlands, actually, the government has trained everyone out of Bobath, and they trained them into task oriented. Now they no longer use it. And many national guidelines, just national guidelines of Australia, some European countries, and India too. India have a stroke guideline that Bobath approaches or any other approach-based treatment are not recommended. So as a modern physiotherapist, we must be practicing evidence-based treatment, the evidence which supports better outcome for patients, right? And you may ask, the NDT, the current NDT is now has integrated all evidence, newer evidence. It is entirely, so it is contemporary now and so on. But is it really? They say so. Is it really? Is it really true? We will discuss this specific question in my next video. Thank you.